Good day, everyone, from wherever you're watching me from. I'm a midwife, and I'm here this morning to talk about an issue that has been raising concerns. That people have been asking me that why is it that during process of labor, a certain tool is being passed into them to collect their urine? Can't they just stand up and go and ease themselves to go and urinate? Because that tool is very painful to some. So this morning I'm here to talk about the tool which is called the urinary catheter, the use of urinary catheter during labor. And with me here, I have the urinary catheter. I think most women that has undergone process of labor knows this. And I have here the Euro bag which helps to store the urine. These tools are not being used in some hospitals routinely for women during labor, while some hospitals use them for women during labor. It's a must. Some doesn't practice it, while some people practice it. As for those hospitals that practice it, I think this is the reason why, and this will also answer your questions that you'll be asking me. Now, what is urinary catheter? A urinary catheter is used during labor when a person cannot empty their bladder due to pain, epidural, or the baby's position. And a catheter, this is a catheter, is inserted into the bladder to drain your urine, and is being stored in this bag. This bag is calibrated. It has readings on it to measure the exact amount of urine that is being passed out from your body. And you know why they are using this? Because when your bladder is full, it will slow down. You know, when your bladder is full, it will slow down your process of labor. It will slow down your labor, so allow that labor to be fast. And secondly, when your bladder is full and these two things are being used on it to empty the urine air, and your bladder is no more full, it reduces the risk of injury to that bladder during delivery or during surgery. There won't be injury on that bladder. You know, during surgery, when the place is full and the position of your bladder and your uterus is very, very near. They are both together, almost together. So when the bladder is now full and they want to cut you, there won't be risk to that bladder. When it's being empty, now the bladder is not empty. When they cut, it won't affect the bladder. But when it's full, definitely there might be a mistake. So, and also, when your bladder is full now and is being empty using these tools, it allows for monitoring of your urine output. They will know that yes, this person is urinating very well. Now, what are the reasons for doing this, for using these tools on you, which is urinary catheter and Euro bag during labor? The first reason is difficulty in urinating. The second one is during epidural anesthesia. The third one is your baby's position, while the last one is preoperative preparation. Now, the first one, difficulty in urinating. A full bladder makes it difficult to pee, and a catheter is being used to empty it. A full bladder, at times your full bladder, when the bladder is full, you find it difficult to pee, and now you are in labor, you are having pains, and at the same time your bladder is even adding to it because you can't pee on your own, two pains together. So the nurses or the midwives will help with this to relieve the difficulty in pain. Then secondly, epidural anesthesia. Epidural is a form of pain reliever. When it's being used on you, you will feel somehow numb, and some of your body process will slow down. So when these two tools are passed, you won't be bothered about, oh, I'm peeing on my body, oh, this urine is coming out uncontrollably. So this will help you not to urinate on yourself unknowingly. So the second one is the third one is your baby's position now. A full bladder can interfere with the descent of your baby. You know, I told us earlier that the uterus and the bladder is almost in the same place. When your bladder is full, your baby's head will not be able to descend very well. You know, I told us earlier that it's a full bladder slows down your labor process. Now, see where the two are related now. When the bladder is full now, your baby's, this I'm relating with your baby's position. It won't allow the baby head to descend, thereby elongating the process of your labor. But once these two tools are used, one is being passed and the urine is now being drained into the urine bag, your baby's head will descend very well, thereby helping your labor to be more progressive. Then preoperative care. You know, I told us earlier that it's when your bladder is now for the preoperative. I told us earlier that when your bladder is full, there must be injury to the bladder. Now, preoperative care. Now you are going for surgery. We have to drain the bladder so that there will not be injury to the bladder. You have to pass this on you. Now we have two types of catheterization. The first one is the indwelling catheterization, and the other one is the intermittent catheterization. The indwelling catheterization, the catheter is being inserted in you and is being inflated. You have to stay for some days, some for weeks, and some maybe 24 hours or 6 hours, depending on what is being used for. And this indwelling is being used on mostly women that cannot make urine, women that might have, maybe they've labored for long. They have to put it in order to correct some things in them. The women that has CPD and are going for surgery, they have to put it in order to control how they will urinate. They use it to correct urination for those indwelling catheter, and it's been left for some days or some hours. Then the second one is the intermittent in and out catheterization. Now, I told us earlier that in some facility they do this routinely and in some they don't. But during that process of labor, when the bladder is full and the midwife notices, you know, she has not passed this earlier. In some they pass it immediately you are in labor, maybe in active phase of labor, that is from 1st cm and above, they pass it. But in some they don't. But once the midwife notices that there is full bladder, she will have to, when the midwife notices this, she has to pass an indwelling catheter into the bladder to ease you, and this help in the descent of your baby's head and also hasten your labor and prevent injury to the bladder. Those are the two types of catheterization that we have. So to some that, oh, they pass this thing few minutes and they remove it, fine. And to some that they pass this, they ask us to leave it for maybe 5 days, 3 days. No, I've told us the reasons now. So the Euro bag now, the function of the Euro bag, this one is a bag attached to the catheter to collect urine. It allows the staff to monitor your urine output, and the bag should always be kept below the bladder to ensure proper drainage and to prevent backflow. So this bag is always down. Some hospital they put inside a baler down. So that is used for Euro bag. It's just used to measure your urine. You know, it is calibrated. It comes in centimeter. We have from 100, maybe you void out 100 urine, 200 urine. So this is where they store the urine. Then we have the potential risks, because at the end of the day, you said, auntie nurse, this thing is paining me. Yes, it's normal for you to have a slight discomfort, a urinary discomfort after the use of this urinary catheter. Then some people, they do have urinary tract infection, especially those that have been on it for some days. Please, if we have all this, maybe urinary tract infection, maybe some. Please, in case you have these potential risks I've just mentioned about the pain, urethral discomfort, and the urinary tract infection, please go to a nearby hospital and complain to the physicians. Thank you, and I hope I've been able to tell us about the question. So if you have any question, drop it in the comment section. I will answer. Thank you. See us next time. Bye.